Kim Ryan, I'm the CEO of the Australian College of Mental Health Nurses.
And you were just on a panel session really about how we should work together. Can I ask you first though, what's your verdict on the NDIS for mental health nurses and for your patients?
Well, in principle, the NDIS is a good program to support people with psychosocial disability. That's fine. The problem we've got in terms of the nurses is some nurses seem to be able to register for working in the NDIS and some don't. Somewhere along the line, mental health nurses are not seen to be providers, which is great concern for us as mental health nurses and for the community and for the people that we could provide better supports to.
Now, you talked in that panel discussion, you said there was a lot of talk about the system. What was your comment about that?
Well, I think the problem is we talk about the system. We don't have a system. We have many systems within a system. We have isolated and siloed services and siloed systems. We actually don't have an overarching architecture as to where we want the services to go and the system to go in the next 20 odd years. We keep tweaking it around the edges, but we don't actually have a system.
You said one way of aiming to bring that about was to actually put some KPIs to ministers. What was your challenge there?
I believe all ministers should have KPIs around mental health and mental illness for the community. We know that having housing, employment, social services are all really important to the mental health of our community. It's not the remit of just the health minister to ensure we have good services for people. So I believe all ministers should have KPIs in regards to what they're doing to contribute to supporting the mental health of the community.
Now, Dr. Bartoni, Tony Bartoni, the president of the AMA, was one of the other panellists there, and he talked about how GPs feel very unsupported in a growing role where mental health is becoming one of their highest caseload. You said actually there had been some help. Can you describe that and say what happened to it?
Well, there had been some help. We had the Mental Health Nurse Incentive Program, which was implemented to support GPs and psychiatrists to provide mental health care to people with more complex mental illness. Someone in their wisdom, when we transitioned to PHNs, decided to undo the funding for that. So we don't have a dedicated program where mental health nurses can actually sit alongside and work with and provide support to people in general practice. Some of the PHNs are working hard to ensure there are mental health nursing services, but we've had a program that had run for nearly 10 years that had been evaluated twice that said it had excellent outcomes for the support to GPs and psychiatrists, to consumers, to their families, and it was very cost effective, and it was disbanded and rolled into the PHNs, which means we have no dedicated program now where mental health nurses can support general practitioners.
So Jerry Norton was who's the head of psychosocial disability in the NDIA, which is the administrator of the NDIS. He was also on the panel. What's your takeaway from what he was saying, and what do you believe the NDIA should now be doing on mental health?
Look, I will give credit to the NDIA for putting Jerry Norton into that position and recognising and hearing what the sector was saying. There was not a dedicated focus on mental health and psychosocial disability within the NDIA and including that in the NDIS. So I think that's a really good thing. I think there is a point where we've got to get the NDIS and the NDIA to be looking at supporting people that don't only have a serious psychosocial disability, that we're actually looking at the large number of people that are not going to be eligible for the NDIA or the NDIS, and how do we ensure that those people, mental illness doesn't ensure that they end up with a psychosocial disability. So we need to look at prevention, and I understand it's early days for the NDIS and the NDIA, but I would hope that somewhere down the track and not too far down, they would start looking at how we support people to not become very disabled through their mental illness.
One of the points he made was that the NDIS was never designed to take the place of the mental health system, which is generally the responsibility of states and territories. What's your?
And look, that's very true. And I think the other thing we have to remember was when the NDIS was being rolled out, mental health was not included at the beginning, and so it's been tagged on. And I think the other problem we've seen over the years is a lot of the psychosocial services that were provided through states and territory governments have been withdrawn. So there is a gap. There's a gap that needs to be filled by states and territories and by the Commonwealth, and that goes back to my point, is there is no system. there are systems within systems, but there is no overarching system as to where we want the mental health services to be going and what is the system we want to see in 20 years' time, so we're not having all these siloed people falling through the gaps and having a number of programs and projects that are still not integrated and, once again, not part of an overall system.
Former Prime Minister Julia Gillard yesterday, she and her government introduced the NDIS. She defended having psychosocial disability or significant mental health issues as part of it, and said that had that not been, people would be advocating for that now. Do you think it was the right decision to include it? Does it fit?
I think it could be included, and I think it is, and it does fit, but I think it's not as simple as other disabilities, and the crafting of the NDIS originally was not about trying to understand psychosocial disability, and I think that's where, in some levels, the NDIS will struggle with trying to understand the complexity around psychosocial disability. And I think the other thing that is a concern to us is the people that are doing the assessments in regards to the packages of care that people receive under the NDIS, and actually understanding what psychosocial disability actually means. And you can't do an assessment in regards to a package of care around psychosocial disability over the telephone.
Thank you very much for your time.